Thanks, Amy. Good afternoon. Welcome. Thank you to all who are returning, and thanks to all who are joining us today for their first time. We're happy to be able to offer another session of our Workforce Collaborative Training Series to our providers in our community. Today, we're very excited to have Erin Parr, CASAC-M Safer Project Director with Horizon Health Services, with us to talk about Cannabis 101, Clear the Haze. Just a few quick notes and reminders before we get started. At the end of this session, we will be asking you to complete a very brief evaluation. We hope that you can take a moment to fill us out so we can continue to improve our training series. Our next session will be Tuesday, May 20th on neurodiversity affirming care, shifting perspectives and practices. Be on the lookout for registration information, which will be emailed out and posted on our website soon. At the end of today's presentation, Amy will also put that registration link in our chat. The recording and slides from today's presentation will be posted to our website within the next few days. The presentations and recordings for our past offerings are posted on our website as well, so we'd encourage you to check those out. We are continuing to fill our calendar for 2025 and are interested in hearing what topics and speakers you would like to hear from. If you are interested in doing a 1-hour presentation, or if you're interested in a particular topic, please indicate that on your evaluation, or you can contact Amy at amy.rockwood@erie.gov. Our training today is being recorded and everyone is muted. I'll be monitoring the chat during the presentation, and Erin will be taking questions as we go. So please put any questions you have into that chat box, and I'll work with Erin to get those answered. Thank you all for joining us today, and I'd like to introduce Erin Parr to talk about Cannabis 101, Clear the Haze. Thank you so much for joining us, Erin. It's all yours.
Wonderful. Thank you so much, Kathleen and Amy. I am very excited to be here today. I am most passionate about sharing accurate and factual information about cannabis and all of its complexities. This is my favorite thing to do, so I am just super pleased to be here and to help increase your audience's cannabis IQ. That's why everyone's here. Everyone's curious about cannabis. Everyone's interested, and I'm so glad to have so many people in the room who want to know more. I am going to dive right in because I have so much to cover. I always joke with my team that the #1 goal that I have is trying to get all of my cannabis information in everyone else's heads. And so I want to try and do as much of that as I can today. With our audience, but just a brief introduction. I am from Horizon Health Services. For those of you who are unfamiliar with Horizon Health, we are the largest behavioral health organization in Western New York. We are actually celebrating our 50th year of providing recovery services to individuals and their families in the Western New York area. We have several parts to our Horizon Health Services program and family, including 43 programs across 30 different locations in Erie County, Niagara County, Genesee County, including both outpatient and inpatient child and adolescent services. So we are treating individuals across the lifespan and across the substance use continuum of interventions. So that is where I am from, but originally I am actually from Canada. So some of you may be curious as to how a Canadian landed in Buffalo, and I can promise you that it was a legal immigration and it was based out of love. So moved here for my husband, and the funny thing about moving from Canada to the US is that cannabis seems to follow me everywhere I go. I was working for quite some time. I spent 10 years working in an early intervention program in Canada, working with adolescents who had a psychiatric crisis, in part due to their use of cannabis. And so our early intervention program was, did incredible work while I was there. And we also kind of lived through the legalization of recreational cannabis in Canada federally. I moved to Buffalo in 2019, and all of a sudden New York State starts talking about legalizing here. And it really felt like Groundhog Day, like, oh man, I've been through this once and like, here we go again. So the really cool thing about that experience being, a cannabis specialist within a early intervention psychiatric program is that I became I became an in-demand speaker on the topic of cannabis use disorders, treatment, prevention, early intervention. Some of the intersections between safety and legalization, and public health, and the enforcement part of it, the impact on the mental health system, and all of those things. So I actually immigrated with the nickname Weed Girl. That was what my colleagues back in Canada called me. And I have been upgraded since I moved here, and I am now referred to by my colleagues as the Cannabis Queen. So if you remember nothing today and you want to reach me in the future, just ask around for the Cannabis Queen. People will know, they'll know it's me. So I do come with 20 plus years of clinical experience. I have my master's in counseling psychology, as well as my CASAC designation here in New York. And I am currently working as the project director of a brand new substance use early intervention program called the SAFER program. So our goal is to actually intervene early with youth who are showing high risk, substance use concerns related to vaping and cannabis. Mostly, but certainly any substance of concern, but mostly, we are seeing an epidemic with vaping, and we're seeing cannabis use on the rise, and perceptions of cannabis use, cannabis safety changing dramatically. So lots of interesting things happening in the cannabis world currently. And I just want to acknowledge that, this is sort of a strange time. We are hustling for eggs on the black market, right? Because they are so darn expensive right now, yet we can go to a licensed store and get our cannabis. So it feels like a very odd time to be in existence, where the things that were once, prohibited and illegal, right, are now legal to those over the age of 21. And my sister-in-law, who's, not so legally growing chickens in her backyard, right, is hustling her eggs on the black market. So it just feels like kind of a strange time. I just wanted to throw that out there. And we have to change with the times, and we do need to recognize that many people in this room are going to have different perceptions about cannabis. And I want to acknowledge that drugs of abuse are neither all good or all bad, right? All substances have a risk and benefit profile. And my job is just to ensure that people have accurate information that's necessary for them to promote safety and to make decisions that are going to be best for their physical health, their mental health, and where they're at in their lifespan. My presentation fully acknowledges that there are therapeutic uses for cannabis, and I validate anyone who has gone down that road and they found benefit of using cannabinoids to treat a particular condition or an illness. And I certainly support people who are doing very rigorous research in that area. More research is coming about, given the fact that more states have legalized, right? That's created some really great opportunities for good quality research to be done. However, my presentation is intended to offer a balanced perspective to the mixed messages that are present in the media today that often focus on the highs or the positives, right, of cannabis use rather than the downsides or the cautions. And those downsides or cautions are necessary for us to support both the individuals that we're working with or supporting in our professional and personal lives, but also for public safety. So just putting that out there as a caveat. I would love to be able to see in the chat. I'm not sure if in presentation mode I can see in the chat or not, but just an idea of where your current cannabis IQ lands. Do you feel as though your IQ is really high, you have a ton of cannabis knowledge and information, and you're really just looking to see if I'm providing you anything new today? Do you have sort of a medium cannabis IQ, or is it low? Like you don't know a whole lot and you're here today because you need to learn more. So curious.
A few responses coming in: medium to high, medium, the general consensus, medium.
Okay, perfect. So I'm really encouraged to see that most people are in that medium zone. I can pretty much promise you're going to learn something new today. And yeah, thank you. I did see the chat responses pop up in the right-hand corner there. So perfect. All right, so I do like to start off with some fun facts, just because cannabis, it's kind of a wacky world to live in, and you learn some interesting things along the way. I am slowly working towards my US citizenship and learning a little bit more about the presidents of the United States. And interestingly, both George Washington and Thomas Jefferson were hemp farmers. There is no evidence that they were habitual smokers or consumers. And again, hemp is very low in THC. It's generally not particularly psychoactive, but just interesting that, you know, they were hemp farmers primarily to create materials needed for making ropes, sacks, canvases, fishing nets, things like that. The very skunky smell that comes with some of the cannabis flower products is actually skunky for a reason. It shares the same chemical, the exact same chemical that is in the spray of a skunk when they are, you know, getting into fights with cats in my backyard on the west side of Buffalo. So that skunk smell, we do have a west side skunk, just so everyone is aware. Please maintain your distance. But the molecule is exactly the same, which is interesting. It's like nature only has so many molecules to offer, and it gave the cannabis plant and the skunk the same molecule. Cannabis has over 1,200 nicknames. I think it's probably the most nicknamed drug or plant on the planet. It did originate in Central Asia and was imported here years and years and years ago, hundreds of years ago. And the other most interesting fact that I like to share with my adolescent patients is that somebody somewhere, some researcher got the funding to get a whole bunch of spiders high. They studied THC intoxicated spiders and, you know, cataloged their behavior. And as you can imagine, their webs were actually very disorganized. They got quite sleepy and they gave up on spinning their webs halfway through the project. They kind of just, you know, decided to go take a nap. So fatigued, disorganized, and really unproductive, right? Spiders when they become THC intoxicated. So just some fun facts to throw at you here. All right, so we are going to start with just some of the foundational pieces related to cannabis so we're all on the same page, and then we're going to get into some of the specific concerns throughout the lifespan and then talk about some safety considerations at the end. Cannabis is a very fast growing bushy annual plant. It is a plant that has 3 strains. Most people are familiar with sativa and indica. There is a 3rd strain called ruderalis, which is not as widely available in North America. It has a lower THC content and therefore it's kind of less marketable, at least in our market. The cannabis plant produces cannabinoid chemicals. THC and CBD are the 2 most common chemicals present in the plant. And cannabis is still the world's most widely used psychoactive, and it has a very rapidly changing legal status throughout the world. Approximately 17% of Americans use cannabis recreationally or medicinally. 35 million Americans use marijuana on a monthly basis, and 55 million Americans in total reported using marijuana within the last year. Okay, and I've already alluded to 2 major chemicals, CBD and THC. There are dramatic differences between these 2 chemicals and their effects. And so when I'm referring to cannabis and it being, you know, psychoactive or problematic or, you know, resulting in maybe some unwanted consequences, I'm typically talking about THC. So I do try to differentiate between THC cannabis and CBD cannabis because they're essentially 2 very different substances and 2 very different drugs. So THC cannabis is psychoactive. It does get people high. CBD cannabis, the cannabinoid in cannabis is actually not psychoactive at all. Oftentimes you will find on the market products that are very high in THC and very low in CBD, or very high in CBD and very low in THC, or you can find kind of balanced or mixed strains that have, you know, a ratio of cannabinoids in them, THC to CBD, and other strains that are maybe not, entirely indica or entirely sativa, but sort of a hybrid mix where one is indica dominant, one is sativa dominant. Lots of details there to kind of dive into because there's so much variation within the plant and the products that are available in the market. I really love this particular infographic because it shows the wanted and therapeutic effects of THC versus the wanted and therapeutic effects of CBD. So as you can see, the therapeutic profile is a lot stronger on the CBD side. Typically, people will, who are considering medicinal cannabis, will, consider the effects of THC as the most medicinal, of having the most medicinal value to them. However, I think it's important to understand that there's actually a pretty diverse therapeutic profile on the CBD side in terms of purported antidepressant effects, anticonvulsant effects, antioxidant effects. It is also a natural antipsychotic, so it can reduce anxiety and agitation. It's thought to be neuroprotective. It helps with nausea and vomiting, inflammation, and research has also shown that CBD can actually inhibit the growth or slow the growth of cancerous cells, which is really interesting. Please note, I'm not saying that CBD cures cancer. It's not where I'm going, but it does inhibit the growth and inhibit the proliferation of cancer cells. Some research has shown, which is really interesting. The main differences between medical cannabis and recreational cannabis is that smokable products, so blunts, joints, vaping products, unless you're vaping the flower and heating it to a point where you're just getting the vapor and you're not getting any combustion, smokable products are rarely recommended for medical use because of the respiratory damage that smokable products can cause. Medical cannabis is also typically microdosing rather than macrodosing, so very small amounts to try to achieve the therapeutic effect. And oftentimes the products recommended are CBD dominant rather than THC dominant. So again, not for everybody. Everyone's medical situation is unique, and in some cases THC is considered to be the more therapeutic cannabinoid to use. However, there's medical research that justifies using THC in a very limited number of conditions, both physical and psychiatric. There's so much more to discover, and again, I think this is why I find the plant so fascinating. And so there are over 400 different chemicals in the cannabis plant. There are 120 plus known cannabinoids. THC and CBD are just the two most obvious and two most prominent. There are over 100 different terpenes in the cannabis plant, and those are the natural aromas and essential oils in the plant that give it its flavor and its smell. And there is what they call an entourage effect between cannabinoids and terpenes, where they work kind of synergistically to create the effect for the person consuming, whether it's a therapeutic effect or a recreational high, or assistance with sleep or energy, or whatever anti-anxiety properties, whatever that person is seeking to achieve in terms of effect. There is something to be considered around the relationship between the cannabinoids and the terpenes. So if someone is interested in learning more about that, I would just do some Google searches and see the terpenes are actually very interesting to study. And they are also responsible for some of the plants getting their names, right? Like sour diesel, lemon pie, because they have terpenes that are a little bit more citrusy in them, and that's what has prompted them to be named what they're named. The other really fascinating thing about cannabis is that it's what we call in the substance use treatment world a mixed effect drug. So cannabis, THC cannabis, does different things for different people. For some people, it can act as a stimulant where it increases the activity of the central nervous system. It'll increase your heart rate, give you more energy, a little bit more focus. People become kind of like a bit more aroused, right? In terms of like energy and attention. And I hear patients say things to me like, I can smoke weed and do my homework, clean my room, get things done. For other people, again, cannabis acts as a depressant, where it slows down the activity of the central nervous system, and it can reduce anxiety, induce fatigue, help with sleep, right? And have more of a calming, relaxing effect. And then for other people, and not everyone, but for some people who are more vulnerable, there is a hallucinogenic effect. And so it can be very mild in terms of, maybe perceiving different colors and smells and sounds with a little bit more like, perceived acuity. Or it can be hallucinogenic to the point where people can become anxious, paranoid, suspicious, and they can start to lose touch with reality and or start to hear things or see things that are not actually there. So those are what we call symptoms of psychosis in the mental health world. And some people do experience that type of an effect from cannabis. So again, these mixed effects are based on both variables within the plant, because as we've learned, there's lots of different components to a cannabis plant, and also variables within the person themselves. And not all weed is created equal. There is a ton of diversity, right, in the weed that's on the market today. Obviously, there are significant differences between legal weed, which we know is tested, right, for purity and concentration, and is tested for contaminants. So it's a safer product for consumers to be ingesting or consuming. Then we also have gray market and black market cannabis, which has not been guaranteed to be tested and could be at higher risk of contaminants or unwanted elements in the product. There are over 700 strain varieties. The cannabinoid ratios are different in every product. Growing conditions, outdoor versus indoor. Like I said, risk of contaminants, and that can include things like heavy metals, molds, bacteria, microbials, mycotoxins, which are kind of secondary metabolites from fungi or fungus that's in the soil that can produce some toxic chemicals that can be harmful to humans. There are also residual solvents from the process of extracting cannabinoid oils, creating cannabis oils from the plant. We extract those oils from the plant matter. We do that using a solvent, so there can be residual solvents in the product as well as pesticides. All of these different variables, again, with the plant and the person, make for a very user-specific, very hard to predict outcome when somebody is consuming cannabis. So the other factors in terms of the plant include the dosage, the strain, how frequently somebody is using, right, and at what potency, the terpenes, the cannabinoid ratios, the method of use. We know that different methods of use actually have greater bioavailability than others and higher percentages of THC available. So dabbing, for example, extremely high potency THC versus smoking a joint, which is going to be lower potency and lower bioavailability. There are also environmental factors. So what's going on in that person's environment at the time that they're high might also influence the effect that they experience, as well as any contaminants. On the person side of things, right, each individual has a unique history of mental illness with themselves, with their family, unique set of genetic vulnerabilities or predispositions, differences in metabolism, tolerance, general physical health conditions. Do you have asthma? Do you not have asthma? Do you have other, issues with inflammation or any breathing or respiratory, chronic conditions that you're already dealing with? Some people can have sensitivities or allergies to the terpenes in the plant. And then gender and age also play a really significant role in terms of the effects. So when children or infants, for example, are exposed to THC, the effects are very, very unwanted and very immobilizing. So a young person, a child or an infant's body, their natural cannabis system, their endocannabinoid system is highly sensitive to the effects of THC. So their bodies and brains can become very overwhelmed, even by small amounts of exposure, right, to cannabis products, which is why we have to talk about safety later on in this presentation. The effects of cannabis are also highly dose dependent, and this is something that a lot of my patients don't have a great awareness of until they start doing some cannabis education with me. At low amounts and low frequencies, cannabis tends to be its most therapeutic, where we get, reduced anxiety, people experience a high, they might have a sense of calm or a sense of energy depending on how it affects them, but at low doses, cannabis tends to be the most therapeutic. At moderate doses, we start to see impaired coordination, impaired concentration, and difficulties with memory and judgment. And then at high doses and high frequencies, there is a much greater risk of paranoia, panic, perceptual changes, and potentially symptoms of psychosis, as I mentioned earlier. Potency matters. Potency is the #1 predictor in my clinical experience of whether someone is going to have an adverse reaction or have a very mild, kind of unremarkable, moderate reaction. So THC levels in any cannabis product, whether it be a smoked product, an edible product, a vape product, THC levels above 18% are considered to be very high. Most street weed currently contains approximately 30% THC or higher. So pretty much all of the products on the market right now are considered to be very high potency, unless you're specifically going to a dispensary and asking for something that's lower in potency or is a CBD dominant product. And then most alarmingly, the dab products, the THC oils, which are, concentrates and kind of distilled versions, right, of THC. They are sometimes referred to as shatter, wax, butter, dabs, resin, live resin. There are lots of different versions. They can be up to 80 to 90% THC. And that is like mind-blowing, for lack of a better word, right? Like legitimately mind-blowing that there's that much THC in those products. So I'd like to hear from the audience at this point. So your best guess, and we're going back in time, we're going to time travel back to 1969, the Summer of Love, the Woodstock Music Festival. I want you to give me your best guess as to what the average THC content was in cannabis products in 1969. Give me your best guess between 0 to 100%. What do we have? Okay, 4 to 10, 40, 15, 7, 15, 6, 8, 5, 8, 10%, 10%. Lots of 10s. Ooh, a 2 in there. Okay, 12%. Wow, 25%. Okay. Interesting. Okay. So I want to give a shout out to the person who guessed like 2%, because I think they were the closest, whoever that was. So the average concentration of THC in cannabis products in 1969 was 1 to 3% nationally. At the Music Woodstock Festival itself, the average concentration of cannabis products was only 1% THC. So I want to help put this in context, right? And this is like a really cool way to do that. So if you, well, I mean, and individuals who were getting high at Woodstock, it was not off the weed. I can tell you that. There was some other substance, combination of some substances being used, but it was not the cannabis that was, creating all those psychedelic effects. So the potency of cannabis products has increased dramatically since 2008, 2010. So 1969, the concentration was 1 to 3%. In the 90s, when I was a teenager, oh my God, I'm dating myself, but when I was a teenager in the 90s, the average concentration was only 4 to 5%. By 2008, it had increased to 10%. By 2014, it was at 12%. By 2018, it was 18 to 20%. And then present day, it's anywhere from 30% for flower and up to 80 to 90% for concentrates. So this is a really important public safety message, because I've worked with a lot of parents who have said, I smoked weed when I was in high school and I did just fine, right? This is not the same weed. This is not the same product. This is essentially a completely different drug. We cannot compare 1990s weed to 2025 weed. It's like apples and oranges, right? So we really want to educate the public and make them aware that the current potency of products is so high that it's a situation in which we need to be very cautious about dosing and frequency, because you cannot dose and frequency without negative effects today's weed, like perhaps people could in the 90s and the early 2000s. So I'm seeing some surprised faces. Amy, thank you for being so expressive, because it sounds like this was a really interesting piece of information for people.
And Erin, one quick question that came in that was back a slide. Someone asked, what is a dab? Just for maybe some people that might not know.
Okay, so yes, a dab is a nickname used for a highly concentrated cannabis product. So again, the plant is, the psychoactive part of the plant is the flower, but if you press the flower and you use solvents, right, to break down the flower, what you can extract from it are oils. Those oils are then distilled even further and made into concentrates. Those concentrates have that potentially 80 to 90% THC content in them. And so those tiny concentrates, they kind of look like, I think I showed some pictures earlier of like the wax and the resin, right? It kind of looks like amber. And those, a little dab of that, that's why they call it dabs, a little dab of that on a heating device, whether it's in a pen or a dabbing rag, is going to create a vapor. You then inhale that vapor, and that vapor contains the THC content, and inhaling the vapor will get you high. So dabbing pens, I'd say, are the most common method of use for this product currently. And that's very concerning because a lot of my adolescent patients are actually using dabbing pens. They're easier to conceal, there's less odor, and they can, like, they're portable, they can bring them with them to school and whatnot, even though they're not, you know, they shouldn't be. So I hope that helps to answer the dabbing question. Okay. So the other
one other quick question, and it's kind of related to that too. So sorry to pause you again. Do those pens fall in the same category? Do the pen carts fall in the same category as dabs?
I'm not sure what we mean by pen parts, but there are, so when it comes to cannabis vapes, right, they generally fall into two categories. So there are dabbing pens, and then there are just sort of generic vape pens. So again, the main difference is more in the concentration of the product, and also a difference in the heating element. So to heat up a dab, you need a stronger battery and a stronger element, right, to heat that product up. A lower potency vape juice, right, is going to require less of a battery and less of a coil heating element, right, to heat it up to get the vapor. So those are sort of like the two main differences. And I know that it can be really hard sometimes to distinguish between what's a dab pen, what's a vape pen, what's a nicotine pen or a nicotine product. Roswell has an amazing study going on where confiscated vapes from schools are actually sent to Roswell for testing, and they will give the school a personalized report back as to what products were in the vapes, what concentrations, and if there were any contaminants. So just a shout out to Roswell and the Western New York Youth Anti-Vaping Coalition. Amy, I can send a flyer out for that program as well if people are interested when I do a follow-up with you. Yeah. And so amazing resource in our community. While we're talking about vapes, disposal of vapes is also a huge safety concern. I think I talk about that a little later in the presentation as well, but essentially they're both considered to be e-waste and biohazard waste at the same time, which is why they're very tricky to dispose of. You do want to detach the juice or the vape cart from the battery, dispose the battery in e-waste, and then deposit the cartridge in a medical receptacle. So or a biohazard container. So most pharmacies have containers for old and unused medications. That's essentially where it should go, because any juice that leaks out from it, whether it's nicotine juice or THC juice, can be toxic topically to children, pets, and other individuals. And so you just want to make sure that you're disposing of those things safely. Okay, any other questions in the chat before I continue? Okay, amazing questions, by the way. Thank you, audience, so much for those. The other thing that a lot of people don't know about cannabis, and I mentioned the word psychosis before, is that cannabis is a known risk factor for the development of psychosis symptoms. And the higher the potency of THC, the stronger the product, the greater the risk. So I kind of use the analogy to, peanuts, right? We can all probably think of somebody in our life that has a nut allergy or a peanut allergy. But most people, right, we know, can tolerate peanut products quite well, right? So in the same vein, right, most people will not have an adverse reaction to smoking cannabis. However, some people will experience transient breaks from reality. It just got very dark in my room. I think a cloud went over my skylight. Sorry. Some people will experience very transient kind of breaks from reality. They may use cannabis and have a very adverse reaction and have like a temporary psychedelic or psychotic-like experience that is quite distressing to them. And then a small amount of people will require treatment and hospitalization because of very acute psychiatric symptoms that result from consuming cannabis products. So if you see anyone or know of anybody in your life who has recently ingested cannabis and they become, anxious, paranoid, they start to have thoughts that are not grounded in reality, they maybe start to hear things or see things that are not there, that is a mental health crisis. That is a situation in which I would encourage you to call 911, support that person in getting, medical care and treatment. A psychotic episode is very, very distressing, right, to the individual, and they do require support and care and treatment and potentially medications in those situations. And we really do want to work to try to resolve that psychotic break as quickly as possible and to prevent another one from happening, because they are very traumatic experiences for the brain. And when I talk to young people these days, they really don't have much of an idea that there is that, connection between cannabis and psychosis. Basic signs and symptoms of cannabis intoxication, withdrawal, and overdose. I'm not going to spend a ton of time on this, but please know that you cannot physically overdose and die on cannabis, on THC cannabis. It's impossible. You'd have to smoke 15,000 pounds of cannabis in 15 minutes to overwhelm your endocannabinoid system enough for it to be a fatal overdose. When we do hear about overdoses related to cannabis or deaths related to cannabis, it's typically because of contamination of the product and or death by accident, injury, misadventure, impaired driving, or somebody has a cannabis-induced psychotic episode, and during that episode, they misperceive their environment, right? And things can kind of go wrong in those episodes. So greening out is typically what we call just your run-of-the-mill. I've overdone it. I've consumed too much, right? I don't feel good. My endocannabinoid system is overwhelmed. When people are greening out, that's a transient experience. Usually people get better within 2 to 4 hours of having consumed. Again, it's very user specific. Some people have greening out effects that last a little bit longer. But for most people that resolves as the THC starts to, the active metabolites start to wear off. Some people do present to hospital when they're greening out because it can come with increased blood pressure and heart rate. It can come with irregular heartbeat. People might be thinking that they're having a heart attack, and so they may present to hospital because of that. Or they may present to hospital because they're becoming anxious or panicked and they're not sure what to do. One of the culprits for greening out, one of the methods that is most likely to lead to greening out, is the consumption of THC edibles. So edibles are wildly popular right now. When somebody smokes cannabis, the effect is anywhere from 1 to 2.5 hours. However, when somebody eats cannabis, the effect can be anywhere from 4 to 12 hours. So a much longer high, but it takes longer for that high to kick in. So there is a lot of unintentional ingestion of a higher dose than planned because people are not experiencing the high in the rapid time frame that they're hoping for. They think that the edible is not going to be effective, so they double or triple their dose, and they end up actually more intoxicated than they had planned. The other issue with edibles is that we don't know where the THC is hiding in that particular edible. All the THC could have landed in the head of the gummy bear, in the leg of the gummy bear, in the torso of the gummy bear. If you're just eating half the gummy bear, you could be getting, in theory, all of the THC, or you could be getting none of the THC. It's really hard to know where in that product the cannabinoids are hiding, which makes dosing really tricky. And with any dosing, we want to encourage people to start low and go slow, right? Please be judicious about it. Please take your time. We'd rather people underdose than overdose in this situation because it can lead to an acute mental health crisis. The other important thing to understand about edibles is that they break down in your body differently than if you were to smoke cannabis. So when you smoke cannabis, it goes into your lungs absorb the THC into your bloodstream takes it to your brain, and you get a psychoactive effect. When you ingest cannabis, it has to go through a completely different digestion system, including your stomach, your small intestine, your large intestine. Your liver has to shoot out enzymes to break it down. Your pancreas has to shoot out enzymes to break it down. And one of the things that people don't know is that THC breaks down into another chemical when you eat it called 11-hydroxy. 11-hydroxy is 3 times more psychoactive than THC. So you think you're getting the THC high and you think you've dosed yourself based on the THC content, but it's breaking down into another chemical that's actually much more psychoactive. So when in studies that have isolated 11-hydroxy, it gets people 3 times higher and keeps them high 3 times longer than THC alone does. So for some people, especially if their liver and their pancreas and their digestive system is not effective at breaking down 11-hydroxy into its next more neutral form, which is 11-carboxy, they are going to get much higher than they anticipated, and they're going to be much higher for much longer than they've anticipated. So anecdotally, I've had patients who've been knocked out for a weekend, 72 hours, right? They're just like in like a cannabis-induced zombie land. And in other cases, I've had patients talk about, you know, overdoing it with edibles and still feeling some unwanted psychiatric effects for about 2 weeks afterwards. So very, very potent. And something that, you know, a lot of people are not aware of. So I love being able to share this information because it is so important and not enough people are aware. So when it comes to edibles, start low, go slow. All right, so I'm going to jump into some of the downsides of cannabis to help, again, weed kind of fact from fiction. We do have a natural cannabis system within our body. So it is called our endocannabinoid system, and it is the reason that we get high when we consume cannabinoids like THC, because THC mimics a natural neurotransmitter in our body called anandamide. And anandamide is really essential for a lot of different things. It is, you know, involved in all of these different kind of physical health processes and these different organs. It is present and very active during childbirth. So anyone who has ever birthed a baby, you would have had a ton of natural cannabis flowing through your body at that time. A, because it helps with pain relief, right? And B, it also reduces anxiety. C, it helps with memory loss so that maybe you think about having a second baby at some point in the future, even if the first delivery was actually pretty nasty. My mom must have had a ton of cannabis in her system because she has 6 kids and just like kept going. It also helps with appetite regulation during labor because I can only imagine that it's kind of hard to eat, you know, like a hamburger and fries while you're also birthing a human. So their natural cannabis helps to suppress your appetite during that moment in time. Anandamide, like I said, is that natural chemical. There are also 3 chemicals in dark chocolate that mimic anandamide's effects within our body. So for all those dark chocolate lovers out there, that is maybe why you enjoy it so much. Anandamide is called the bliss chemical. And I would suggest that dark chocolate is a very blissful experience. I'm a big fan of dark chocolate. So that's just sort of a bit of a foundation about the endocannabinoid system. And I want to talk about some of the downsides that come with chronic use. So when I talk about the word chronic with my patients, they often think of the person that's smoking like all day, every day. And you know, has a really significant, you know, habitual use or loss of control. Chronic from a medical standpoint is actually only 3 days a week or more. So 1/2 gram of cannabis product, right? Or the equivalent in concentrate of 1/2 gram, 3 times a week or more is considered chronic. The reason for this is because if you don't give yourself a 72-hour window, a 72-hour break from your use, the active THC metabolites will never be depleted from your brain and your body. They will go into storage in the fat cells, right, in your brain and in your body. It's that incremental buildup of THC in your fat cells that leads to some of the downsides that I'm about to talk about. And those downsides impact our dopamine regulation, and they also impact significant brain functions, including learning and processing speed, memory, executive functioning, that's our frontal lobe, right? The part of our brain that's responsible for all of the planning, decision-making, thinking things through, decreased emotion regulation, poor verbal fluency, not being able to find the right words, attentional deficits, amotivation and anhedonia, so lack of pleasure and interest and low energy, very much mimics depression, and obviously physical dependency or addiction. The brains that are most sensitive to these neurocognitive effects are the adolescent brains and child brains. So we know that the developing brain, that's a time where your natural cannabis system is on overdrive. Between the ages of 12 to 24, your natural cannabis system is causing your brain to go through a huge growth spurt. This includes, the proliferation of white matter, a thickening of the cerebral cortex, what's a very fancy word called dendritic arborization, which means that each dendrite of each neuron is growing like a tree up to the sky, to kind of reach that next neuron and make a connection. We know that cannabis affects how long those dendrites can grow, and therefore whether a connection can be made. So the effects of exposing a teenage brain, an adolescent brain that's trying to grow and do all of this like final pruning and proliferation and rearrangement, the exposure of that brain to outside cannabis causes a massive disruption. We see fewer neural connections in very important brain regions, and we know that there's actually a thinning of the cerebral cortex that happens because those dendrites don't get to grow and expand, right? And reach as far as they're supposed to reach. So there are some neurocognitive effects that are not just present during the time that the adolescent is using cannabis, but unfortunately, these effects in some cases can be long lasting and do not diminish over time. So they are kind of permanent deficits that we see into adulthood. Including less control over emotions, difficulty problem solving, slower processing of new information, lower verbal comprehension, poor memory, and in more significant cases, up to an 8-point IQ drop that is not recoverable. So again, up to 8 points, right? Anywhere from 2 to 8 points, right? An IQ drop that is not recoverable. This does not mean that if you are over the age of 25 that you're like free and clear. There's actually some research, some longitudinal research that shows that there can still be up to a 5-point IQ drop in adulthood and a risk for early dementia with heavy or chronic use of cannabis during that part of the lifespan. But most young people, again, they don't have this awareness. And so cannabis use is associated in adolescence with less likelihood of obtaining a college or university degree, lower life satisfaction, difficulty achieving meaningful life goals, and youth become more dependent on THC faster than adults do. That developing brain is highly neuroplastic and very sensitive to the effects of dopamine. So the development of a substance use disorder can happen at a much more rapid rate than with an adult. So for example, young people who experiment with substances before the age of 15 are 70% more likely to develop a substance use disorder in their 20s. So within 7 years, actually, I think the stat is 13. If people are using before the age of 13, they're 70% more likely to develop a substance use disorder by the time they're 20. Those rates are like staggering. So early intervention is super important, and also, age of first use plays a big role in how people, are impacted by cannabis use long term. And again, I said middle-aged brains are not completely in the clear. We do need to consider the impact of cannabis use on middle-aged brains. So there is an increased risk of early onset dementia, memory and attentional issues, and potentially an IQ drop. There was a more recent study that was published and in the news just in the last 2 weeks about how adult hospitalizations related to cannabis were highly correlated with future diagnoses of early dementia. So again, there are neurocognitive impacts of this very high potency THC on our middle-aged brains as well. Pregnancy is also a spot along the lifespan continuum that we really strongly encourage women to consider abstaining from cannabis, right, for the best possible health and wellness of themselves and their child or their fetus. Many people do choose to use cannabis during pregnancy or to self-medicate for nausea and vomiting. Any country or state that has legalized cannabis has seen an uptick in the number of women reporting consuming cannabis while pregnant. Again, that is sort of, in my mind, speaks to the overall change in perception of safety with cannabis once it's legalized. And that's a really tricky thing because the legal status of a substance does not change its risk and benefit profile, right? The risks are still present. So we see increased risk of stillbirth, preterm babies, lower weight birth weights, and a greater need for neonatal care, and then higher rates of autism and SIDS post-birth. There is a movement called Ganja Mamas, where there are many women around North America who have come together, and they believe that cannabis during pregnancy and cannabis while parenting is a very healthy choice for them. 5% of pregnant women do report smoking in the US. This is the most commonly used substance during pregnancy in Canada. And I respect their choice. I respect their beliefs, right? This movement is, an interesting one. And I don't know that they have all of the information. What we do know is that there is no safe amount of cannabis use during pregnancy. There are effects on the neurocognitive function of the child throughout their lifespan if they've been exposed to THC in utero. And again, the developing brain is the most vulnerable to the effects of THC, and your brain is also in a very critical period of development from the ages of 0 to 3. So there is a greater risk of developing a substance use disorder by the age of 18 if you've been exposed to THC in utero. There's also an impact on fertility. I'm going to kind of jump through this for the sake of time. But there is smoking, whether it's THC or cannabis, has a significant impact on fertility in both men and women. So something to be mindful of if you are, considering pregnancy or if you're dealing with fertility issues. The overall physical effects of cannabis include, the unwanted physical effects of cannabis include, greening out, exposure to toxins and carcinogens with the smokable forms, EVLI, which is electronic vaping associated lung injury. These are lung injuries that can occur from all of the products that are harmful to your respiratory health that are present in the vape products. Respiratory infections, a weakened immune system, skin damage and aging, mouth and gum disease related to the smokable forms of cannabis, and then cardiac effects. The other individuals in the middle-aged category or older who should not be consuming cannabis, it's not recommended, is anyone who has a cardiac condition. Again, this is new information for a lot of people, but there are many contraindications with medications and cannabis. It should not be combined with any other depressant medication or substance. So anything else that causes sedation, it should not be combined with. And also other medications, including Viagra, warfarin, benzodiazepines, Prozac, and anyone with a history of heart attack or stroke. So the heart attack concerns come from an increased risk of atrial AFib, right? Atrial fibrillation. I probably butchered that, but AFib, irregular heart rates, and myocarditis, increased risk of heart attack and stroke in relation to cannabis use. So not recommended for anybody that has a cardiac condition. I've already touched on some of the vaping risks, but what I want to mention in this slide really is that the second and third hand aerosolized vapor from the vapes is very toxic to the people that are exposed to it. So it's not just the firsthand exposure from the person that's using the vape. We really want to strongly encourage people to consider vaping outdoors and not to vape inside. The second and third hand smoke ends up landing on soft materials and surfaces in our home environments and can off gas and also be very toxic. There can be heavy metals, ultrafine particles, VOCs, and cancerous chemicals. And essentially that aerosol over time creates toxic dust. And that's harmful to the other people, right, living in the same environment. There is a condition called cannabis-induced hyperemesis or hyperemesis. It's a cyclical vomiting syndrome that can occur when people are very heavy, regular, persistent users of cannabis. The onset is typically several years after chronic use, but most people don't associate their vomiting with cannabis because they have the perception that cannabis actually causes the munchies, right? It gives you an appetite. It doesn't make you nauseous. Well, again, the effects of cannabis are dose dependent. So at high levels, it can cause this. At low levels, it can create the munchies. So something to be aware of. Often people will present at hospital thinking that they have a GI infection when really they don't. It's cannabis induced. There's a significant impact on mental health. So for those people that are already experiencing anxiety, depression, suicidal ideation, psychosis, or schizophrenia, THC cannabis is not recommended. In fact, cannabis is a risk factor, right, for the development of psychosis, and at high potency and high frequency and high dosage can cause anxiety and cause depression. There is a really interesting book called Tell Your Children, The Truth About Marijuana, Mental Illness, and Violence, written by Alex Berenson. His wife is a psychologist, was treating a lot of people with cannabis-induced psychosis. He became super interested about it and sort of summarized a lot of the research and stories in here. New York Times bestseller. If anyone wants to better understand the connection between cannabis and mental illness. We also know that there are epigenetic changes where your DNA can be altered through regular use of cannabis, and that can be, impact future generations. Okay, I am going to skip ahead to some of the safety considerations regarding legalization, given how much time we have left. As I mentioned, the legal status of a substance does not change its risk or benefit profile. So we do want to make sure people are still aware that the cannabis plant has not become safer. Cannabis products have not become safer. If anything, they've actually become more potent and stronger. Legalized cannabis is a safer product because it is tested. These are the things that are currently legal: 3 ounces of cannabis flower or 24 grams of cannabis concentrates in your personal possession. It is still illegal to sell to under 21. It is illegal to share with under 21. There are some benefits to legalization, and one of them is consumer safety, because we know that those products are rigorously tested. But there are also some unintended consequences and some concerns that come from legalization as well. So there are still very strong black and gray market sales. There are underage sales that are occurring all of the time without penalty. The risks associated with the very high potency products, as I mentioned, there is a decline in smoking flower and an increase in dabbing and concentrates, increased use of edibles, lower consumer product awareness. I find that people have more accessibility to products, but they actually have not taken the time to really educate themselves about what it is that they're putting in their body. And there is sort of a mixed economic benefit. What I've seen in Canada is that there was a massive green boom financially, and then the market kind of tanked. So it'll be interesting to see if there is going to be that kind of same economic experience in New York State. And then there is an increased perception of safety. So please know that cannabis impaired driving is a DUI. Driving high is a DUI. This has not changed. There are over 600,000 New Yorkers that self-report driving cannabis impaired annually. There is, again, with that increased perception of safety, there's also been an increased perception that, a DUI that's cannabis related is no big deal. It is actually a big deal, and you will get a charge. There are drug recognition experts that will assess you roadside. A number of unintended consequences working in the schools. I see a lot of unintended exposure to cannabis with people bringing it into school. So we do encourage people to focus on safety, not just safety in relation to being aware of potential contamination, but certainly safe storage. So we encourage cannabis products to be stored out of sight and under lock and key as you would opiates, because kids don't know the difference. Right? These are all THC products that look exactly like regular candy and snacks on the market. So please encourage people to be safe with their cannabis. There's a little bit more to share, but I know we've got 2 minutes left, and the rest of the organizers are going to want to share a little bit of information about the next presentation. So I'm going to leave it there. Please know that all these slides will be available. We didn't touch on every single thing, but I think we covered a lot today. So thank you so much for listening and increasing your cannabis IQ.
Thank you so much, Erin. We do have a few questions that came in, but what I'll first just note is Amy did put a link to our evaluation in the chat. So if you could just take a few minutes to fill it out, it's just a few brief questions. We would appreciate that. She also posted the link to our May training on neurodiversity as well. But if you had time, do you want to take a few questions that were in the chat, Erin?
Absolutely. I do not have anything scheduled at 1, so I am good to stay on for a little bit.
Sure. The first one was earlier in the presentation, you mentioned about disposing of the e-juice in take-back boxes. This comment is that, or question, the drop boxes in Chautauqua County do not allow liquids. Do you have a list of drop boxes that would accept these?
So the, I mean, essentially, I mean, if you're looking to get rid of a full one, right, that might be a little bit trickier. An empty one might be accepted in those receptacles. I would ask your local pharmacist where the best, what the best option is for disposing of those. You could also contact Roswell and send them to Roswell if you so choose. That's another option. But yeah, if it's full, usually people are looking to get rid of empty ones, but yeah, if it's full, I would ask your pharmacist.
Thank you. Another question. What is the current conversation between ADHD and cannabis?
Oh gosh. Yeah. So ADHD and cannabis, there isn't a lot of research, like solid scientific research that shows that there's a benefit to cannabis for that diagnosis. If there is a recommendation for cannabis, it's probably CBD rather than THC. We do not want a young brain under the age of 24 exposed to THC if it's an adult looking to self-medicate. Certainly clinically, I hear patients talk often about using cannabis to self-medicate for ADHD symptoms. But again, because the plant and the products are so variable and user specific and hard to predict, it's a challenging option for people. And then you're constantly weighing the benefits against the potential downsides, right? And everyone has to make that determination for themselves, whether the cannabis is helping more than it's hurting, right, in any particular situation. But there isn't a lot of great, there isn't a lot of solid scientific research to support it. If it was being prescribed medicinally, it's probably a CBD product.
Thanks, Erin. For those still on, Amy actually also put in the chat if you'd like Erin to come back to do a part 2, because there is so much more information and so much great information to share. Please notate that on your evaluation. One more question I see in here. Can you touch on fentanyl in cannabis?
Oh gosh.
A pretty big one.
Yeah, for sure. And I did have some slides I had to jump around over, but at the moment, there are 0 reports of fentanyl contamination in any of the New York State licensed legal products. The OCM has been very clear about that. They're the Office of Cannabis Management. All of their products are tested for drug contamination as well as other contaminants. I have heard of fentanyl contamination in some vape products and some flower products that were obtained from gray or black market sources. We do encourage everyone to fentanyl test their products, whether you're, dismantling the vape and taking some of, obtaining some of the juice and testing the juice, or there are some methods for testing the flower as well, by putting the flower in a baggie, kind of shaking it around, getting some of the oils to stick to the inside of the bag, adding some water to the bag, shaking it up, and then testing that liquid for fentanyl is another way of testing. We encourage people to test all of their products because the main message right now is if you did not get it prescribed to you, if it did not come from a pharmacy or from a legal dispensary, there is a chance of fentanyl contamination. So people should be very, very mindful of that risk and take all the necessary precautions.
Great. And just a comment, and it was in response to, I think, the question about the disposal of cartridges. There was someone who commented that some of the licensed dispensaries around here accept spent vapes, both cannabis and nicotine. So that might be another option for the person who had the question about disposal.
That is super helpful. I actually didn't know that. So thank you, audience, for teaching me something new today.
And yes to a part 2, lots of yeses. So
yes, okay. Yeah, I would love to do a part 2. I would love to do that. Thank you so much for that idea.
All right. Thank you again, Erin. That was fantastic. Great information, a great presentation. We appreciate your time. And thank you to everybody who is still on and who listened through some of those questions. Thank you.
Awesome. Thanks so much, everyone. Have a great day.
You too.
Bye.
And don't forget